Hello and welcome. If everybody could take a seat, please. You are all really welcome to this Beaumont RCSI Irish Cancer Society Lung Health Check Community Evening. This evening is the culmination of a lot of work done over the last couple of years by lots of different groups, doctors, the Alliance Medical, the Irish Cancer Society provided a lot of funding. And we're delighted. Anne-Marie and I are from the Irish lung cancer community. It's a small patient support group for people who are impacted by lung cancer. So why are we here? Why are we all here this evening? We're here to get information on what the lung health check is, okay? And the evening will be broken down into a number of short talks given by the principal investigators who were involved in this check. And also there'll be some brief videos to show how the process goes, and also some a real life experience of someone who's been through a lung health check in the UK. Yeah, I guess that's pretty much it. Anne-Marie, would you like to take over?
So my name's Anne-Marie Baird. I'm a cancer researcher. I'm a patient advocate. And as Seamus has already said, I'm a member of the ILCC. And it's fantastic to welcome everyone to this, which has been a huge community and team effort. So it's my pleasure now to introduce our first speaker of this evening, which is Amy Nolan, who's Director of Clinical Affairs at the Irish Cancer Society.
Thanks, Anne-Marie and Seamus, for your introduction, and it's really great to be here and see so many people here today. And as Seamus and Anne-Marie said, a huge amount of work over many years has culminated in this evening, so it's great to see so many of you here. I am Amy, I'm the Director of Clinical Affairs at the Irish Cancer Society, and I'm really honoured to tell you about the origins of this programme. In 2019, the Irish Cancer Society launched a lung cancer action plan, and we highlighted the need for improvements in prevention to stop people getting lung cancer in the first place. We drew attention to international research on the potential of lung cancer screening to save the lives of those who do have cancer. And we called for such a screening programme to be introduced in Ireland. 3 years later, Professor Jarushka Naidu came to us and gave us the opportunity to back that call with investment. So now we are proud to be partnering with Jarushka Naidu, with Dan Ryan and with Patrick Redmond and their colleagues in Beaumont RCSI Cancer Centre to make Ireland's first lung cancer screening programme a reality. With funding of €4.9 million by the Irish Cancer Society, it is the largest single investment in lung cancer in Ireland's history, and it is a turning point for this disease. With this transformative investment, we are rewriting the story, reshaping the future, and redefining what is possible in the fight against lung cancer. So by participating in this pilot, people will have an opportunity to potentially have a cancer picked up before the symptoms even appear. And by catching lung cancer early, as we all know, we're giving patients and people a chance and giving our healthcare system the ability to intervene at the most effective moment and giving families more time together. So we know from international research that this pilot programme will save lives amongst those who take part. And we also hope that in time, it will lead to a free national lung screening programme for everyone in Ireland who is at high risk of developing lung cancer. So just as an initial investment of €1 million started the National Bowel Screening Programme from an investment with the Irish Cancer Society, we really feel that this will ensure that a lung screening programme will take place in the future. So I really hope you enjoy this evening and enjoy listening to our speakers. it's going to be a really exciting evening. Thank you.
So, as you heard, there's 3 principal investigators. The first of them is Professor Patrick Redmond. He's one of the Lung Health Check study leads. He's the head of the RCSI Department of General Practice, and he's going to talk to us about general lung health. So, Patrick.
Yeah, good evening, everyone. Very nice to meet you all, and thank you very much for coming to hear about our program. We've had to keep this a secret for about 2 years, and I'm terrible at keeping secrets, so it's really nice to be able to actually talk about this now. And so we'll do the formal bit, but afterwards, around the tables, we can have a proper conversation about what this means. So Seamus said, I'm Patrick Redmond, so I'm a GP here in Dublin, and from my perspective, which is maybe not the most important perspective when it comes to lung cancer, it's a real challenge. So you know this, but just to reiterate, before now, we didn't really have a good test for diagnosing lung cancer. So ultimately, by the time people were presenting with symptoms, they already had advanced cancer. And that's what you can see in some of those graphs that are on the slide. And when you have advanced cancer, obviously your options in terms of treatments become much less clear, and that your survival is impacted. So that's the challenge. And really, for us, in terms of what people might present with, it's vague symptoms and really trying to shift the dial, trying to move back earlier in the diagnostic process is what this test is all about. So trying to use CT scans to identify lung cancer earlier before people have symptoms. An obvious question from the audience, I thought, might be, well, does it work? And so the kind of reassurance, and others will talk about this later on, is that we have plenty of good evidence internationally from trials that this does work. So when we focus CT scans on those who are at high risk for lung cancer, you can detect those nodules earlier. So really, now the challenge is, how do we do this? How do we do this as a service? How do we do this across a population? And there's many other countries that are working on this. I suspect you probably heard that the UK has proposed to do this as a national screening program. So we are on a similar journey about understanding how we can do this here. So when I talk about the implementation challenge, I mean, these programs don't work if people don't participate. So people who would benefit most don't come and avail of the test, and they're not going to work. And that has been the experience in some other countries. So in America, anywhere to 10 to 20% is the participation rates, whereas different models that are used in the UK, and what we'll explain to you more this evening, have shown much better participation rates, up to 50%. So for those who are eligible, 50% are participating. I want to talk, just in the last few slides I have, about some of the principles of how we try to design this program and why it looks the way it does. So I think we all realize that the healthcare is not delivered fairly, and there's often an equity issue about those who deserve it most don't receive it. And we can see that in patterns. So what I'm showing on this slide is screening in other cancer types, breast, bowel, and cervical. So those with less means don't always get the opportunity to participate in screening. So it's something that very much we're aware of as we begin to design this program, that we try and tackle this. So the challenges. So one is obvious: physical barriers and psychological barriers to participation. And that's what I want to talk about next, is in terms of the design of this program, what we've done. One you can see is there's a truck outside. So certainly as a GP, I often think, the best tests, the shiniest tests, they're all in the hospital. But the idea here is that we take it out of the hospital and bring it closer to where people live. Much the same as breast check. I'm sure you all have seen the truck that drives around and offers mammograms. So it's the same idea. Let's take those tests and bring them closer to where people need them. So that's an obvious innovation that I think that has been shown in the UK works. But then there's other elements, which is the psychological stuff. What do I mean by that? So there's a real fatalism about lung cancer, and understandably, I suppose, in terms of what the likelihood when you have a lung cancer diagnosis. There's also a stigma. We know smoking is related to lung cancer. So these are all challenges that we should try and address in terms of encouraging people to avail of this test. And there's some of the discussion that we'd like to have with you this evening and that we'll do afterwards in some of the tables behind. It's also about trying to, as I said, bring those tests out of the hospital, bring them into the community. So we've really been so pleased to have the partnership not only, for example, here in Fingallians tonight, but other GAA clubs and working with our partners in Centric Health and some of the practices that really has been a wonderful opportunity to work with them in designing this program. But also we hope that we'll, naturally the follow-on is to think, well, we start this here in this region, but it potentially could be an example for how we might do this as a national program. So what does it mean practically? So we've been working with the practices to help them to identify patients who would likely benefit from this program. So thinking about those in a certain age categories between 55 to 74, and to invite those individuals to undertake an assessment to see that would they be eligible. So what does that mean? So initially looking at GP records to identify these individuals and then inviting them through or giving information around the study through a letter and then a telephone assessment. The telephone assessment leads to a risk calculation. So that's what's on the right-hand side of your slide. So a risk calculator to see would this person benefit from the screening program. What do I mean by that? So we're looking for individuals who are at high risk for lung cancer so that if we use this test, that the yield will be sufficient and will minimize harm. We can talk more about that in time. How it's calculated, it's a mixture of things. Some are obvious, so obviously age, smoking history, and some other things that are listed on the slide. So this is some of the basic principles of what we've been working on for the past 2 years, a community-based, trying to ensure that we get good participation. We know the evidence is there that this program works internationally, but we want to build an evidence base in Ireland so that the National Screening Service and the Department of Health will see the potential for it here as a national program. So I'll hand over to Jerushka now, who will talk more about the scientific program more generally. So thank you very much.
So thank you so much, Patrick. So it's my pleasure now to introduce our next speaker, who's Professor Jerushka Naidu, who's one of the Lung Health Check study leads and a huge driver of this program in Ireland. And Jerushka is Professor of Medical Oncology and a Consultant Medical Oncologist at Beaumont RCSI Cancer Centre. And Jerushka is going to give us a little bit more information on the how and the why. Jerushka.
Hi everyone, it's lovely to see you here today and thank you all for coming. This is all for you. So I hope that this is something that is going to be very important to you and for your community and to help us all in the fight against lung cancer. So what is the lung health check? We've learned a little bit about Patrick, about why we're doing it. And just to add a little bit more information about that, why do we care about lung cancer? Why is lung cancer important? Lung cancer, unfortunately, is a very common disease. It is actually the cancer of men and women that unfortunately leads to the greatest number of cancer-related deaths in Ireland and worldwide, and has done so for the last 30 years. So it's one of the top 5 cancers. And in the last number of years, it has also been recognized as the #1 cancer that affects women, with a hugely increasing number of cancers in women, particularly in Ireland, now ranking as one of the cancers affecting the most women in Ireland, being one of the top 5 countries in Europe in which we see this. What we also know is that the distribution of lung cancer, where lung cancer happens, might be different in different places and appears to be more common in North Dublin for various different reasons. And this is why we as a group had hoped that this is a place where we can start to see if picking up lung cancer early can help folks here, and this can then potentially expand to other parts of Ireland. As we've heard from Professor Redmond, this is not something that's new. Lung cancer screening has actually been around for about 10 years in some parts of the world, like the US, and maybe more recently in other parts of Europe. And this is based on clinical trials. That's where all of our discoveries in medicine come from. They're discovered in trials, and then they're brought in as a new way to diagnose or treat conditions. And two big clinical trials published in our foremost journals, like the New England Journal of Medicine, have shown that there are benefits to doing a CT scan or an all-over check of your lungs in folks who might be particularly at high risk. And one of the benefits of doing screening, you see in the little bar graph at the top, is something called stage shift, that when we wait for somebody to have a cough or have a symptom that could spell lung cancer, most of the time if we do a scan or do some tests then, unfortunately the cancer has moved to an advanced stage. However, if we use some risk factors like the score that was mentioned, and we do a CT scan and other tests early, in 80% of cases, we will pick up the lung cancer at a much earlier stage, stages 1 or 2, in which we can give good treatments that may have better outcomes. But what the bottom graph shows, which we heard as well, is that lung cancer has a bad stigma attached to it. Sometimes it's associated with this idea of don't ask, don't tell. But what we're here to tell you is if you pick up lung cancer early, or if you attend, you qualify and you attend, there are now better treatments out there that are associated with better outcomes for lung cancer. We also heard that this is not new across the world and that there are large programs like in the UK that have been very successful. This particular program is actually part of a larger program in Europe. When we approached our partners at the Irish Cancer Society, we had also been approached by the European Union. The whole of Europe had recognized the unmet potential of doing lung cancer screening in Europe. And through a program called the Solace Consortium, we are part of a 10-country group in which we've received funding from the EU in order to bring this to the people of Ireland. So this is something that's not just important to Ireland, but also important to Europe. And one of the main areas here is to try to enrich female participation, to try to reach folks where they are at home, hard to reach populations, and those who might be at high risk. How we are running this, and where someone like me comes in, who is a cancer specialist, is we're running this as a clinical trial. And that means we're running it to see how we can do this best. So in those who qualify, they will be required to sign a little form to say that they agree to participate. And this is because we are trying to understand how to do this best. That even though it might be done in certain ways in other parts of the world, it might need to be tailored in terms of how it is done in Ireland. So in this clinical trial, the goal of the trial is to assess feasibility. How is this done in Ireland, and should we adapt it in specific ways for the Irish population? But we're also going to gather lots of other information. Does a cancer that's picked up by screening look or behave differently to a cancer that comes to the hospital when a patient develops a cough? What are some of the other findings that we might pick up? And you'll hear from Professor Ryan about a very comprehensive plan of what to do if other things are picked up. This is also an opportunity to talk about other things that are related to one's lung health, like smoking and other important outcomes. So we do some breathing tests and other things to optimize your lung health in those who qualify. Are there better ways to do lung cancer screening? There's now some new science to say certain blood tests, maybe some breath tests, maybe taking a sample of the sputum might help us to do this better in the future. So there are some research elements to this as well, which are optional for those of you who are interested to take part in. As Professor Redmond mentioned, this is really a collaboration. It's a collaboration between primary care, GPs, community sites, the GAA, and hospital, all working together to try to innovate and try to do best for the population. This is a huge team. As Anne-Marie and Seamus mentioned, this is a team of over 15 people that have worked together for several years trying to bring this together. And this includes consultants in the hospital, GPs, a huge network of GPs in North Dublin and beyond, surgeons, researchers, patient advocates, members of the National Screening Service, and others. So really, it's a huge team that we represent here today, and we are all here for you and all here to answer your questions. As Professor Redmond mentioned, this all starts with GPs. Those who are potentially suitable will obtain a text message and a letter in the post to start the ball rolling. In those who qualify, they will then be invited to come to community sites to make it more accessible for those who want to take part. This process, which again we've already outlined a little bit, but just to give a little bit more information to, those who might participate initially get a text message and a letter. We have obtained a special permission from the government in order to even reach out to these folks so that they can take part in a program like this. And then on the phone, we will ask a series of questions, or something that we call the risk scorecard, to see how high is the risk, and is this something that will be suitable for you? We, of course, don't want to do a test or a series of tests in those who are not at highest risk, because we could then be doing a test on someone who is not likely to benefit as much from taking part. When a person is invited, we will also make sure that they're suitable for taking part based on their age, based on not just those risk scorecards, but perhaps where they are, what other conditions might be relevant, such as any other cancers, so that we make sure that we pick up those folks who are most likely to benefit from this. So with this, we're going to have a series of videos of more information from Professor Ryan, and just to say that it takes a village to get this done, not just in terms of the team, but also in terms of the funding and support. And this is just an example of all the different funders and all the different players that have been important in getting this over the line. So we're about to start. May 19th is going to be our first scan, and we're really hopeful that as many of you in this area and beyond may benefit from this. Thank you very much.
Thank you, Professor Naidoo. The process itself, I'm going to talk to you a little bit about. Professor Naidoo has been through quite a bit of it already. Because it's a clinical trial, everything has to be very specific and predefined. So the age group is defined as being people between 55 and 74 years of age, and members of Centric practices. And obviously, you're all members of Centric practices because you got the invitation here tonight. So the invitation letter goes out to take part in the study, and this will specify a time and date that you'll receive a phone call. And with that, you'll also receive an information leaflet which has more details about what happens and how it happens. And a member of the booking team will then give you a call, and they'll ask you some questions about your medical history, your smoking history, which is all part of the pre-screening. And then these questions will really define whether or not you're suitable to have a low-dose CT scan, and if it's right for you or not. So if you are okay to have a CT scan, then you'll be invited to come to this location and go on the truck to have a scan. Just to say that at the end of the talks, there's one more talk to follow, a couple of videos. There'll be an opportunity to ask questions. There'll also be an opportunity to meet people face-to-face afterwards. There's a number of tables around the back there that you can ask people if you don't want to ask from the audience. There's also a couple of small A3 posters on the walls which give an indication of what the path is, very simplified pathway for someone who does go, who does accept the invitation, what happens and what are the different routings for those people who accept it. So at great expense, there was an actor invited to do the the process, and this is the video of how that goes.
Excellent acting in that video. come see me later if you'd like to book him for a gig. So the next video that we're going to see is taken from a UK experience, which was a lady who was part of the Doncaster Lung Health Check. So this video is going to play, and just to note that the process that she's gone through in the UK, the process here in Ireland may be a little bit different, and that goes back to what Jarushka's already said, that we need to ensure that the systems we have in place are suitable for the area that we're in. So that video is going to play now.
My name is Sandra and I live in Doncaster, a mining village just outside Doncaster. I received a letter inviting me to go for a scan on my lungs down at Rossington Miners Welfare, and the letter was a telephone conversation with a lady and asking me questions about my health, that I was fine, but I had been smoking. But I had 16 years since I stopped, and I was on the borderline with the questions that she asked me, and she asked me if I would like to go down to the Miners Welfare and have a scan on my lungs. And I got down to the Miners Welfare, went into the truck, and the girl that was there was so relaxing for me. She talked me through everything and told me not to be nervous. I went into the room where the scan was. It is not very big at all, it is only small. She said I'd be in for 2 minutes. I was very, very nervous because I didn't really know what to expect going in the scanner. Went in the scanner, I couldn't stand it, I asked her to get me out. The girl fetched me out of the scanner. She talked me through it, that there was plenty of time, that I had nothing to be worried about. She fetched somebody and they went in the scanner just to show me how long and what happened. I went back in the scanner, I was in there for 2 minutes. I shut my eyes really, really tight, come out, and she did calm me down. She talked to me, she was very pleasant, and I stayed there for about 10 minutes, quarter of an hour. She fetched me a drink of water. All in all, it took half an hour at the most. About 7 days later, I got a telephone call to tell me that they had found something on my lung and that an appointment would be made at Doncaster Royal Infirmary for me to see a doctor. Appointment was made for about 10 days later. I went to DRI, I spoke to the doctor, and he said that it was definitely cancer that they'd seen, and that he was going to make me an appointment to have a CAT scan at the Northern General in Sheffield. As I was going to Northern General, I was absolutely petrified. My husband couldn't come in with me because of COVID. I sat in the waiting room and I didn't know what to think. I was so frightened. But when they called my name, they were so kind. Really, really kind. It did last for about 10 minutes, but they were talking to me all the time. They were absolutely marvellous. Came out of the scanner, my husband came to the area and picked me up, and we came home, and I was so relieved to get home. I was so frightened. Approximately 10 days later, I got another letter to go and see a Mr. Rao at the Northern General. And again, my husband couldn't come in with me, and I went to see Mr. Rao. He told me it was definitely an operation, that's if I was prepared for one. I got an appointment, and I had to be in Northern General for 7 o'clock one particular morning, July the 21st, one of my best friend's 70th birthday. I'll never forget. And I went that morning. I said to my husband, Never had an operation before, didn't know what to expect. The staff in the Northern General was second to none. They talked to me, they laughed and they joked. And two guys that took me down to theatre. And that was it. I didn't know anything else until I got back up on the ward. The staff were absolutely amazing. The treatment was second to none. And I was only in for 4 days in Northern General. 4 days and I was home. Mr. Rao has told me that everything has gone. Took some lymph nodes, took everything out. I lost a third of my lung and that everything is gone. I've got nothing to worry about. Mr. Rao came to me and told me I had a drain in. He tested the drain and said to the nurses, that can come out. She doesn't need her oxygen and your cancer has gone. I could have kissed him. And again, I was very emotional. And the girls that were in the same ward as me congratulated me and said how pleased they were. It is very hard to describe what that feeling was like. I thought, I've got my life back. And I just felt as though a weight had been lifted off my shoulders and all this had happened in a matter of a couple of months. Please, please don't hesitate. Don't be frightened, just go and do it. It saved my life. Because going down there for the scan, even though I was on the borderline, I could have turned around and said, no, I'm all right. But I did, I went. I am a very, very, very lucky lady.
Isn't that a great story? She's not an actor. That's real life. So, she accepted the invitation. She went forward. She had her scan. So it's if you get an invitation, then please take it up and just get yourself checked out. Okay. So the next section is how findings are managed. Our speaker is Professor Daniel Ryan. He's a clinical lead for the lung health check and is a respiratory consultant in Beaumont RCSI Cancer Centre.
Good evening, everyone, and thanks so much for coming out this evening. I think that last video really highlights the importance of this pilot and really emphasizes the message of what we're trying to get across, that, you know, if you're high risk and if you're invited, please do come. It's important to remember, though, if we ring you and you're not high risk, that's a good thing. So don't feel upset if you don't get invited to take part in a scan. It means that you're of lower risk to the rest of the population, and that's actually good and good for your health. The real key is that we check to see if you're high risk or not. So I'm just going to speak a little bit about how the process will work after you come into the truck and what will happen afterwards. So there's essentially 5 main elements. The first is a respiratory assessment where we'll check your general lung health, looking for things like COPD, smoking-related diseases of the lung. If you're a smoker and you want help to stop smoking, we will offer you some advice on the truck, and then we can refer you to our local HSE tobacco cessation services, who do a phenomenal job in helping people stay off tobacco. Some people will be invited and asked to provide some biospecimens as part of our research. Then you'll go on to have your CT scan, and then after that, we'll arrange your results and your follow-up. So the first part is the respiratory assessment, and this involves 2 main elements. The first is some questions about your lung health. This involves questions about cough, breathlessness, bringing up sputum, all these kind of questions, which will help lead us in a direction that you may be symptomatic. And coupled with that, we offer a breath test called a spirometry test. This is where you blow into a tube and it measures the amount of oxygen that you push out of your lungs in a second. And that can help us identify if you have COPD, which is a smoking-related lung disease. And the reason we do that is in participants who are high risk for lung cancer, there are also high risk for COPD, which is a smoking-related disease that can make you breathless. And there is growing evidence that if we intervene earlier in participants like that, with things like inhalers and smoking cessation and other sort of health interventions, then that can have massive benefits for your health down the line. So if we identify that you have potentially COPD through this respiratory assessment, we will let you know. So you'll get a letter in the post saying that we found some issues with your breathing. We'll let your GP know, and most importantly, we'll arrange a plan. So that might involve a letter to your GP advising that you book an appointment with them, meet them and discuss potential interventions, or we might arrange an appointment for you in our community respiratory hub where we can do some more tests and arrange a treatment plan. But you will be informed. Some people who come to the truck will still continue to smoke, and we will offer participants some non-judgmental advice on how to stop smoking if you want it. And then after that, if you want a more intense smoking cessation service, then we will provide that at your local HSE service. Again, this is a non-judgmental thing. It's just for people who want help to quit, and we will help facilitate that. There is a biomarker aspect to our trial, and there's growing evidence to suggest that by doing a CT scan coupled with some blood tests and other tests, that you can actually use these things sort of synergistically to identify people who are a higher risk or not. This will be available to some participants and is completely optional, and if it's something that you don't want to do, you don't have to do it. You have that complete choice yourself. You'll then go on to have your low-dose CT scan, and the reason we say low-dose CT scan is when you go into hospital and get a CT scan of any part of your body, that CT scanner exposes you to a certain amount of radiation. And when it's in a hospital-based scan, that equates to what we call about 7 millisieverts, right? Over a long period of time, that radiation dose would probably be too high for screening. But we have specially designed CT scanners that significantly reduce any radiation dose that you get down to about 1.4, 1.5 millisieverts. That's about the same as a airplane flight from here to the United States. So it's very, very, very low radiation exposure, and it's important that you know that. So when you go on to the scanner, you'll be in the scanner for about 45 seconds. It's very, very quick. You don't have to take off any clothes. You just jump up on the scanner, and it's done very, very quickly. You don't need to change or anything like that. After that, the scan images will be beamed directly to a group of radiologists based primarily out of Beaumont Hospital, thoracic-trained radiologists who will read your scan in conjunction with artificial intelligence. And the reason we do that is AI is really, really good at looking at little spots in your lungs, and it can identify them very, very accurately and identify them if they are potentially sinister or not. And when we use AI coupled with the human radiologists, it's very, very accurate at identifying any problems. And it's done to the highest international rigor. And what we're doing is we're looking at your CT scans. This is just a 3 different CT scans. The vast majority of people, this is what we look like. Nothing to worry about, everything normal. In some patients, we'll find little blemishes called nodules on the lung. The vast majority of these are benign things. They're not sinister whatsoever, but we may invite you back at a shorter period of time, 3 months, just to scan it again to make sure it's stable. Most of them will have gone away. Some will remain stable again, and we'll invite you back at a later stage after that. And on rarer occasions, we'll identify something like you see on the far right there, which is a bigger spot in the lung that looks like a tumour. And at that stage, then we'll be inviting you in to our rapid access clinics to further assess that. So in reality, there's, let's just say there's 100 participants in the room, which there probably is at present. If 100 of those participants are high risk, are invited to have a scan, 82 or 83 of them, it'll be completely normal. So no problems whatsoever, which is very reassuring. In about 13%, so in about 13 or 14 patients, we'll find one of these little blemishes, one of these little spots that again are likely nothing to be worried about, but will require a scan at about 3 months after that to make sure everything is stable and make sure it's not growing any bigger in that time frame. And then in only 4 participants out of those 100, we'll find something that we're a little bit more worried about, and we'll invite you into our clinic to do more tests. And of those, only 2 then will go on to have lung cancer. So 2 out of 100 who undergo the test will end up having lung cancer, which isn't a large number, but in a societal basis, that equates to huge numbers of lives saved and huge benefits for health in general. So with this trial, everyone who takes part, who's high risk, will have a scan at the start, and we call that T0. If it's completely normal, everyone will be invited back for another scan in a year. So that's, everyone has 1 scan, and then regardless, you'll be invited back in a year's time for a second scan. And at that point, the trial will end. If you have one of these small blemishes, you'll be invited back after your initial scan at 3 months, and then at a year, okay? So everyone will get 2 scans, some might get a little bit more. So after you have your lung health check, and this is very important, we will let you know your results. So you will get a letter in the post informing you of your results. As well, your GP will get a letter informing them of the results as well. So you will know exactly the results of your tests, your GP will know exactly the results of your tests, and if there's any plan that we need to put in place, you'll know exactly what that plan is. We'll arrange it with you, with your GP, and with the hospital. So for participants where we find something that's a little bit more sinister, you will be invited to one of our rapid access lung clinics. Myself and my colleagues in the audience here, Professor O'Brien and Dr. Coonahan, run the rapid access lung services in the sort of North Dublin and Drogheda area. We will see you in our clinic within 10 days of us getting this result, and we will arrange any follow-up tests for you, which may involve other scans, potentially biopsies, and then after that, if there is evidence of lung cancer, then more than likely you would need an operation, and that operation would take place in St. James's Hospital, which is the National Cardiothoracic Cancer Centre, performs 80% of all the lung cancer operations in the country, and is one of the preeminent lung cancer centres for surgery in Europe and even the world. As well as informing you by letter, letters can be scary, so if people who have sinister findings or findings that need a little bit more workup, we will ring you as well. So we'll run a virtual clinic where we'll ring you, tell you that there's something that we need to follow up on. We'll let you know the plan, so just that you have that extra bit of reassurance from us that everything is in place and that there's a plan in place for you. So lung cancer screening, unlike other types of screening, involves imaging of more than just the lungs. So when we scan your chest, we scan your neck, your thyroid gland, your heart, the vessels beside your lungs, and even your liver, spleen, and down to the top of the kidneys. So sometimes, not often, we will find something that we weren't aiming to find, but could have consequences or implications for your health. So, for example, if you're a woman and we do a CT scan and your chest is completely clear, but we incidentally find something on a breast, Okay, that's something that we need to inform you of and formulate a plan for. Now, it doesn't happen often, but it does happen. And we have very robust processes in place by which, if we find something like that, we'll tell you, we'll tell your GP, and we'll arrange a plan for you. And that will involve either a referral to a local specialist or a referral back to your general practitioner, where we'll arrange a plan for you. So there's lots of little areas that this might happen. And it's important for you to know that if we find it, we'll do something about it, and that you'll be informed of the plan as we go along. So, as I said before, everyone will get a scan at the start, everyone will get a scan after a year, and then a small proportion of patients with little blemishes on the lung will get a scan at 3 months. At the end of the screening, which is after the second scan after a year, if you have any findings at that stage that need further follow-up, we'll arrange that for you in the local hospital, which will be Beaumont for the people in this room. We will arrange all that for you as well, and we've robust mechanisms in place to make sure that all that happens. So if there's any message I want to convey to everyone here, is rest assured we've left no stone unturned to make sure this is as safe and robust as possible. At all stages, when you undergo and have a scan, we'll let you know your results, we'll let your GP know your results, and we'll formulate a plan for you if needed. And I think it's important that everyone takes that message home this evening. So, thank you.
So I'd like to invite Professor Naidu and Professor Redmond up. We're going to do a question and answer session now. So we're happy to take any questions from within the room. And this is also being live streamed, so we may get some questions from the side as well. Sorry, yeah, straight away.
Okay.
The microphone, yeah.
Thank you. I'm just not 100% clear myself. This is something I would like to be involved in, but you're not necessarily invited, is that right?
So if you're between 55 and 74 in the participating Centric Health practices, you will receive an invitation of a letter and a time for a phone call.
And then you'll be triaged.
And then you'll be triaged, yeah.
But you will get the invitation anyway.
Exactly.
Okay,
yeah.
Thank you.
Thank you. Do we have any other questions in the room? Okay.
Hello. If you don't smoke, you still can get lung cancer, can you?
Yeah. So
that's true. Yeah, that's true. You can get lung cancer even in those who don't smoke. But screening has the most information to support it in folks who did smoke a certain amount in their lives. So for the purposes of this trial, one of the questions assesses smoking history. And so that's one of the risks that we're going to look for to take part. So while there are definitely people who will get lung cancer who never smoked, they may not be the population that benefits from screening. And so that's why this trial is focused on that group of patients to start out.
Over here.
Hi, I was just wondering if you have COPD, when you're, as you were saying, they're doing the test for COPD, will you give advice on how to best manage your COPD?
Yeah, so if you've known COPD already, we'll reflect that back to your general practitioner because we'll know. So what we're really trying to look for is people who are walking around with COPD but don't know it. Because that's, there's about 20% of people in Ireland who have COPD don't know it. So what we're trying to identify is those participants, and then we'll initiate a plan for them, and that'll either be with their GP or with the community-based respiratory services.
Yeah, you mind, Dan, if I might add to this as well. So I think there's also an opportunity as well as a GP. So we have this new initiative around chronic disease programs in general practice. So I think if we identify some of these illnesses, like you said, COPD, that we have an opportunity to give that information back to the GP, and then you can participate in a chronic disease program with your own practice, and that, as you said, look at medicines, inhalers, and so on afterwards.
Hi there, just checking, are you ready to kick off straight away? Or is there a time lag between today and when we start to get the letters out?
Yeah, well, it's a great question. Yes, no, we are. We're finalising everything. You can see the truck outside. You know, we've a fantastic group of people working with us through Alliance Health who have, we've worked, through over the last, 18 to 24 months, making sure all these systems are really robust and in place. We're putting the final polishes on it now, but we're ready to scan by the 19th of May, and we're very confident that we'll be equipped to make sure everything works well from that date.
Dr. Ryan, Dan, this side. Just from the online, I think maybe we just clarify a little bit about the invitation process. I think some people found the text messaging around tonight's event a little bit confusing. So one of the questions is, will people still be able to attend even if they couldn't attend tonight?
Yeah, so tonight's an information evening. What we're planning to do is everyone in the participating Centric Health GP practices between the age of 55 to 74 will get an invitation letter. On that invitation letter will be a time and a date for a phone call. We'll ring you and then go through your assessment there and decide if you're high risk or not, and then invite you for a lung health check if you're high risk. When the letter arrives, if you don't want to take part, there'll be a number on it that you can text or ring and say, I don't want to take part. That's completely your choice as well. But everyone in the participating Centric Health GP practices will receive a letter of invitation between the age of 55 and 74, and then we'll ring you at a specified time, and then if you're high risk, after our assessment, we'll invite you for a scan. So that's the process.
What kind of issues in the triage decide if you don't need to be referred for a CT?
Yeah, so there's as Professor Naidu alluded to, there's a risk score with a number of different variables. A lot of them are due to your age, your smoking history, your family history of specific illnesses, family history of lung cancer, and we use those to calculate. So they're all weighted to create a calculation of how likely you are to develop lung cancer in the next 6 years. And if you hit a certain point, then you're deemed high risk, and then we'll invite you. If you're low risk, that's a good thing. It means that you're less likely to develop lung cancer than anyone else. So don't be disappointed if you're not invited for a scan. That's actually a good thing for your health. It's still important to go through the process, but if at the end of it we say you don't qualify, don't be disappointed. That means that you're at a slightly lower risk level than the rest of the population who will be invited. But it's still important to check these things out, okay? And I will say, while I have the chance, it's really important that we're really honest with each other here as well. None of these tests are 100% guaranteed, okay? So for example, I think, there is a little bit of stigma around screening in Ireland. You'll know this yourselves. No test is 100% accurate. So there is a risk of missing things. There's a risk of, someone who we deem as low risk that ends up having lung cancer after a couple of years. These tests are not foolproof, but they're designed in the best possible way to make sure that we hit the high-risk populations as much as possible.
Another question from online. Whoa, that's very loud. What happens at the end of this study? So people are brought back and scanned after a year and the study ends. So what's the next step after that?
So if people still need findings followed up at that stage, we'll arrange all that for you in the hospital. If you're talking about from a more societal level, what happens with lung cancer screening at that stage, we have to use all the information that we get from this to create an argument. And that argument is an argument around funding, around government funding, around need for this. So what we need is participation rates. We need to collect that data together then, and then we need to use that to build a cohesive argument that lung cancer screening is needed for the country, and we can only do that with participation.
And just to say, the argument is already being made. So the team already includes the National Screening Service. It already includes the Irish Cancer Society, major voices who have the ability to really advocate for this, for the population in general, and for us, those who may benefit from this, yourselves who may benefit from this. So all of those things are in place to try to help things move forward. It starts in North Dublin, but hopefully it will expand from there.
Can I add as well? So the evidence is lots of things. So the evidence is about what the scans show, how much economic costs and so on, but also your opinions. So we have a number of parallel projects running where we're interviewing people and surveying people. So you can hear more about those projects which are parallel to that this evening. And Conor Murphy's in the background who can tell you more about those projects if you want to get involved.
Hi, just to clarify a point, I suppose, from one of the patients, and maybe you can just allude to the numbers of people that have been screened and the time frame over which letters are going to be going out, so people don't have an unrealistic expectation that they'll arrive next week.
So we're, as I said, there's 4 main scanning zones. One is in Swords, one is in Drogheda, one is in Raheny, and the other one is around the Croke Park area, and they're based around 4 GAA sites. So we're starting here in Swords. We're going to start sending out letters next week, and then we're going to start scanning on the 19th of May. And what will happen is the cluster of GPs practices around Swords will be invited. You'll get a time and a date for your scan, and then we'll move away. And then if you need further follow-up at 3 months, we'll come back after a period of time and you'll be invited back again. So it moves in a sort of a circumferentially like that. You know, our plan is to scan about 2,000 patients in total, and that's in the 19 Centric Health GP practices, and then to scan everyone again a year afterwards. So if we hit our mark at about 2,000, then we have to stop. And if that is the case, we don't have the facility really to scan more at that point, because we are, you know, as you can imagine, this is extremely expensive, and we only have a certain amount of funding that will allow us to scan so many people. So our aim is to scan about 2,000 participants in the 4 zones over a period of 6 to 12 months, and then again a year after that.
Okay, we have another question here from online. If you have COPD, will you have a high risk of lung cancer and be referred for the CT scan?
Again, it's all related to the risk score. So if you have COPD, your risk score is going to be higher, primarily from the fact that you've smoked. So it's all mathematically weighted. So if you have COPD, that means your cigarette smoking pack history, or the amount of cigarettes you've smoked in the past, is going to be higher, which means your risk score is going to be higher. But it doesn't guarantee that you'll be invited. It's all very, very mathematically modelled on the risk scores that we have.
Hi, I just want to ask, I know you said that there was a limit of 2,000 and that's where you had to stop. But currently, if you have a partner or a spouse that meets all the same criteria, can they apply to take part?
So at the moment, we've obviously had to design this program over the past 2 years, and we're working with the practices who have designed this program with us. So the individuals are already identified, essentially. So it's those between 55 to 74 in the practices as Dan was talking about. So ideally, in time, if we prove the benefit of this, we'll be able to expand this program nationally. But it is, for now, is defined already who will be participating, and we'll get their invitations in the post within those practices.
Okay, do we have any other questions in the room? Okay, over there.
Good evening. What I'd like to ask you is there any peculiarities that identify North Dublin and the Drogheda area with the lung cancer more than other areas?
Look, it comes down to socioeconomics, to be honest. You know, if you see the graph, the difference, there's a very stark difference between lung cancer rates in South Dublin and North Dublin, for example. And that's because certain parts of North Dublin and areas of North Dublin have higher cigarette smoking rates. And unfortunately, higher cigarette smoking rates affect people from lower socioeconomic backgrounds more than people from higher socioeconomic backgrounds. It's a widely known fact. And as a result of that, people from lower socioeconomic brackets are more likely to have smoked in their lives and are more likely to get lung cancer. And unfortunately, that affects clusters of populations in the North Dublin area more so than anywhere else in the country. And that's why that signal is so high in North Dublin. It's also, you know, areas around here have the fastest growing older population in the country. if that makes sense. So the number of people over the age of 65 is much, much higher in these areas than in other parts of Dublin and in the country at large. So that's basically the two signals as to why it's happening more around here. But it does make it a good place for us to start this, you know.
I just want to reiterate, is this information evening just tonight, and then the next time we send out letters, is that the way it works?
Yeah.
Thank you.
Over there.
Good evening. Is there not already a treatment in Ireland for lung cancer, or is there just...
It's definitely me. There are lots of good treatments for lung cancer, yes. What is new is there's no lung cancer screening. So this is the first pilot to try to pick it up early through this lung health check mechanism. But once we pick it up, we do have access to all the doctors and treatments that we would in the rest of the world.
Okay, we have one more question online. Someone who tried to register for a patient information evening and all the slots are gone. How can they access information about the evening?
So this evening is going to be pre-recorded. This will be made available on the Lung Health Check website through the Centric Health Practices and any of the available links. So it can be easily accessible and anybody who's here or not here can watch it later.
Great, thanks so much. So we've no other questions online. Is there any last questions in the room? If not, I'll hand back to Seamus, who's going to close us out for the evening.
All right, thank you very much. I've been asked to close the evening and I wondered what I'd say. Lung cancer is a terrible disease. Historically, the survival rates have been very poor. But things are changing. For lung cancer, things are on the up. Lung cancer screening is a huge development that catches lung cancer early. Okay? When it's caught early, it's much, much more treatable. Okay? And therefore the survival rates increase quite a lot. Personally, I was diagnosed with stage 4 lung cancer almost 9 years ago. I was very lucky to get on a clinical trial and get the right treatment for me. So it just shows that, you know, science is evolving very quickly, and the statistics were poor. But what I tell other people who are diagnosed is we're the ones who are now changing those statistics. They're going to improve, and they're going to improve quite a lot, and screening will help that. Just to finish up, thank you all very much for coming out tonight. We really appreciate you coming here and listening to each of the talks. Please give the invitation you receive some serious consideration. Please take it up. And the last thing is there's tea and coffee available. Please stay and have some. There's also a number of information booths around the end of the room. The principal investigators will be here. The rest of the study team are around. Anyone you see wearing one of these identifiers, please ask some questions and find out whatever you need to know. So thank you again.